Whoever he is.
Chad Eaton, he's Congressman Shuler's Public Affairs Director. And we can't hear you. This is Chad Eaton. He's Congressman Shuler's Public Affairs Director. And on behalf of these citizens here who peaceably assembled to petition their government for redress of grievances, I present these 80 letters to be delivered to Congressman Shuler, our elected representative. And I believe Mr. Eaton has a statement from Heath Shuler, and I'm hoping he can address the question that many of you had, what's going to happen to these letters. So I'll turn it over to you.
The first thing I'll address is what's going to happen with your letters today. I've already spoken to our D.C. office, and as soon as we go back in, they've requested that I fax those letters to them immediately. So as soon as I have a chance to meet with y'all, we'll go back in and we'll get any letter that you have faxed to the Congressman immediately today. And I do have a statement from him today for you, or from our office in D.C. for you today, as well as I wanted to assure you that he's meeting with the representatives from your group in D.C. at 1 o'clock today, because I know there's a rally in D.C. today, and his office has gone to great lengths to make sure that y'all are represented, and Erica Franzi and a group will be meeting with him in D.C. at 1 o'clock today.
Quiet.
You go make this one?
Order.
You failed out on the last meeting you had scheduled when we were in D.C. before.
Let him speak.
Is he going to make this one today?
I'd be happy to read a statement, but it'd be a lot easier if I didn't have to speak over people. This is a statement on the health care. We received the bill last week. It's almost 2,000 pages long, and it will take a while to comb through all of the details. The Congressman is not going to make a decision until he knows exactly what's included in this legislation. He's pleased to see some positive changes in the new legislation, including the repeal of an antitrust loophole that currently allows health care insurance companies to drive up the price of medical care. This measure would bar anti-competitive practices such as price fixing and allow for increased state regulation. This provision is similar to the Health Insurance Industry Antitrust Enforcement Act, H.R. 3596, which he co-sponsored last month to create more competition in the insurance industry and drive down prices. The Congressman still has some serious concerns about this health care legislation. It is absolutely necessary that any reform that happens must be fiscally responsible. He's also concerned about the coverage for illegal immigrants and abortion in this bill. As you know, the Congressman is pro-life, and he has urged House leadership to take funding for abortion out of the health care bill.
All right.
On Tuesday, November the 3rd at 10 p.m., the Speaker of the House dropped the manager's amendment. The 72-hour waiting period began when that amendment was dropped. Until he has read and fully analyzed the contents of the bill and changes made to the bill through the manager's amendment, he will not make a decision. The Congressman does not support a robust public option. And that's the statement I have. The Congressman does not support a robust public option. That's the statement I have.
Yeah, folks, Erica asked that we not get in any debates with Congressman Shuler's staff today. I mean, everything that's been said has pretty much been said. And she asked that, after Eric read the statement, that we just go down in the corner with our signs.
Okay.
Unless you have anything else you want to add.
One more thing. Bill Thomas. Yes, sir. You step up to the chair.
Bill Thomas has got a few words to say.
Thank you,
Thank you.
Thank you. My name is Bill Thomas. I'm from Hendersonville. If the health care bill passes, my wife and I will lose our Medicare Advantage plan. The bill cuts $400 billion from Medicare over 10 years. This wipes out our plans, and any of you who have the Medicare Advantage plan, you will lose your coverage. It's an assault on senior citizens. We will experience an increase in monthly premiums of more than 1,000% because we will have to then go back to Medicare and the Medicare supplements and the Plan D drug card. We will, this is not going to be affordable for most seniors. They'll be paying for the nationalized health care, and that will fall on our backs. We don't need socialized medicine in the United States. Not now, not ever.
One more speaker.
My name is Jim Mueller. I live in Glenville, North Carolina, over in Jackson County. And I want you to know, Medicare is funded to 1917. And in 2017, it runs out of money. Social Security, for those of us that are older, is not endowed yet. And if you're young people, you're going to get screwed because they haven't made provisions to take care of Social Security in the future. And that's running, and with all these people out of work right now, this country needs jobs. It doesn't need Medicare. It doesn't need any of this stuff. It needs to get people back to work so we can afford to do this stuff. And it's jobs. Now, when people got jobs, they have health care. We've had tens of thousands of people in North Carolina that have lost their health care because they lost their jobs. And nowhere, all I've heard from Senator Hagan and the president is tax the rich. Let's tax the rich. Let's raise taxes on this. Let's raise taxes on that. And some places are talking about raising tax on pop and stuff like that. It's always tax, tax, tax. How are we going to get the economy going again if we're giving all our money to the government and you can't give them enough? They'll never have enough. That's why we're in the tank we're in. They keep spending and spending. The time is to say no. Let's balance a budget. Let's think about that.
You don't have a job, you can't pay your taxes.
You can't pay your taxes.
We have one more speaker. Bill Lack, you're going to speak from there or come up here?